The therapeutic landscape in many disease areas is becoming more and more fragmented. For example, by 2015, the type 2 diabetes marketplace will shift from this to this. In this increasingly competitive field, smart marketers need a way to shift from a pipeline mentality to a patient-centric treatment model that positions pipeline assets for varied market segments. Patient typing is a critical research tool for defining and uncovering insights into customer segments that are so pivotal for developing effective, patient-centric marketing strategies. I'm CarbonSix President Margaret Mueller, and I recently gave a presentation on patient typing with Greg Kalesa of Janssen Pharmaceuticals at the 2012 PBERG annual meeting in Chicago. Here's an overview of the knowledge we shared that day. Patient typing provides a number of benefits to the positioning and development process, including prioritizing business opportunities for new products, identifying patient types with the greatest opportunities for specific benefits, evaluating product concepts and mapping those opportunities onto the types, and then sizing the business opportunities for each product concept by type in order to prioritize efforts. Guiding portfolio decisions. Starting with using customer needs to guide licensing decisions by identifying gaps and unmet needs in a therapeutic area, and prioritizing pipeline asset development. Finally, patient typing helps us ask for a doctor's business in a meaningful way by understanding how treatment approaches, unmet needs, and desires for new treatment options vary across types, assigning real personas to patient types in order to assess how emotional positioning elements resonate with physicians and patients, and to conjure a relevant patient type in need for a new treatment option in conversations with physicians during sales calls. The first problem with patient typing is that we don't do it enough. Marketing teams may resist doing the work because they view it as embracing a niche strategy. Nobody wants to give up any part of the pie. But there is a real debate over which is the better strategy, owning all of a well-defined but smaller share versus trying to carve out a small piece of a much larger market. Further, marketing teams sometimes feel like they already know the market, having identified some broader, obvious characteristics of the various patient types. The second problem with patient typing is that we don't do it well. Internally driven patient types that lack direct physician input may fail to have real-world customer relevance. Conducting research with only patients or only physicians can also misrepresent the dynamics of patient-physician interaction. Without a dedicated patient typing research plan, insight mining is often limited to a 5-minute segment in product profile qualitative research, where physicians often give obvious or pat answers. Here's a brief example of getting patient typing right. In this study, research was conducted to understand how physicians categorize patients with a certain disease state and how resultant categories may influence treatment decisions. Before the interview, doctors prepared brief patient profiles for several patients. They then created a list of all the relevant patient characteristics that drive choice of treatment, as well as the descriptions of the groupings they would use in order to classify patients. Physicians also provide creative visual examples from magazines or the web to illustrate their feelings towards various groups. This exercise served as a qualitative cluster analysis of patient records, and in conjunction with moderators helping tease apart patient types in telephone debriefs, developed an initial set of patient types with descriptive attributes and therapeutic needs. In the second phase of research, Phase 1 respondent physicians were brought back to participate in mini focus groups and individual interviews. Key attributes were selected for physician evaluation based on their prevalence and ability to achieve treatment goals. Respondents then reached consensus on how attributes travel together, forming recognizable but complex patient types. As you see, these types go far beyond simple classifications of mild, moderate, or severe. Finally, physicians evaluate how product concepts fit with the developed patient types. As a result of the research, we found that some concepts demonstrated clear differentiation for use in certain primary and secondary groups, and along with segment sizing, provide a clear business opportunity index an effective roadmap for prioritizing pipeline assets. That's just one example of how we can properly utilize patient typing to deal with a more fragmented future marketplace, while eliminating some of the common pitfalls of more basic efforts. So how can CarbonSix help your research? We can do it more. Patient types are not obvious, and marketers need to understand how physicians view the world, not how we see them or how patients see themselves. Patient typing research is an essential tool for both understanding business opportunities as well as guiding how to ask for business during sales calls. And we can do it well. In a dedicated patient typing project conducted by researchers who specialize in the method, we utilize real patient records as well as inductive and deductive analytical techniques to get at insights that just aren't possible with hastily conducted or shallow patient typing efforts. If you'd like to learn more about patient typing or to receive the full presentation deck from our talk, please contact info@c6research.com and mention this video, or call us at 312-321-8293. Thanks for watching, and keep an eye on c6research.com for upcoming case study and methodology videos.